it's me. My presentation is going to be over the 13 categories and the 2 sections of disabilities. Now, when I introduce the video, there's going to be 13 categories, of course, and 2 sections, high incidence and low incidence. Low incidence is the less common of the 2, and among those 13 categories, the high incidences fall among, the one falls among the high incidences is specific learning disabilities, speech or language impairments, intellectual disabilities, and emotional disturbance. And among low incidence disabilities are multiple disabilities, deafness or hearing impairments, orthopedic impairments, other health impairments such as like ADHD, visual impairments, autism, deaf blindness, traumatic brain injury, and developmental delay. Those are the 13 categories I'm going to discuss, and those are the 2 sections I will discuss as well, and I'll try to give examples of each with pictures, and hope you guys enjoy. Our first section is Section 1, High Incidence, and the first category is Specific Learning Disabilities. In specific learning disabilities, it mainly focuses on reading disabilities and math disabilities. Students with math disabilities tend to not fully understand why they're learning math. They may pay attention in class but not fully grasp the full concept. Students with reading disabilities tend to show anxiety and test avoidance and usually have ADHD. Category 2 covers speech and learning disorders. According to IDEA, officials describe speech disorders as stuttering or impaired articulation, problems with voice, and language impairment. Category 3 covers intellectual disabilities. Intellectual disabilities is the disability characterized by significant limitations in both intellectual functioning and in adaptive behavior, and it covers most social and everyday practical skills that the student may endure. Some symptoms is learning and developing more slowly than other children, as well as having difficulty to communicating. Most intellectual disabilities happen before 18 years of age. Category 4 covers emotional disorders. Students with emotional disorders have an inability to build relationships and are usually depressed. They are unusual rage and anger, hyperactivity, and gets irritated fast. Section 2 is the least common of the 2 sections, low incidence. Category 5, multiple disabilities, includes any of the disabilities such as intellectual or orthopedic impairments. Usually students with multiple disabilities have to have accommodations because their disability causes severe educational needs and they cannot be accommodated without special attention. This term does not include deaf blindness. In layman's terms, students with other disabilities are categorized under this category. Section 6 includes deafness. Full hearing loss and hard of hearing are some of the symptoms of the deaf community, and people in the deaf community are usually under this category. Category 7 includes orthopedic impairments. According to IDEA, this includes impairments that are caused by disease such as bone tuberculosis or other diseases that includes cerebral palsy or actual physical disabilities including amputations and fractures. Furthermore, there can be an absence of a member or club foot that can cause the impairment. In Section 8, this includes other health impairments. Mainly, this includes ADHD, epilepsy, or anything else that affects the student's educational progressiveness in their school system. This is considered an impairment because since a student can be so sick they can miss a lot of school, and that ultimately affects their educational progressiveness in the future. Category 9 is visual impairments. This includes students that have low vision or blindness. However, there are some visual impairments that can be corrected with glasses or contact lenses.
According to the CDC, a visually impaired person's eyesight cannot be corrected to a normal level. It may also be said that it is functional limitation of the eye or eyes or the vision system. In 2006, 11 million people that had visual impairments could be fixed, and 17% could not. Section 10 includes autism. Autism is ever-changing and can be considered high incidence. There are communication issues, repetitive behaviors, and social challenges. The definition for autism is a mental condition that is present from early childhood, characterized by difficulty in communicating and forming relationships with other people and in using language and abstract concepts. The symptoms include immature behavior, self-biting, and communication issues, of course. Section 10 includes autism. Autism is ever-changing and can be considered high incidence. There are communication issues, repetitive behaviors, and social challenges. The definition for autism is a mental condition that is present from early childhood, characterized by difficulty in communicating and forming relationships with other people and in using language and abstract concepts. The symptoms include immature behavior, self-biting, and communication issues, of course. Category 11 is deaf blindness. Deaf blindness is a combination of sight and hearing loss that affects a person's ability to communicate, to access all kinds of information, and to get around. It is not a deaf person who is blind or a blind person who is deaf. It is both. Category 11 is deaf blindness. This is a combination of sight and hearing loss that affects the person's ability to communicate and access information. The two impairments together increase the effects of each other, and symptoms include vision loss and hearing loss. Category 12 is traumatic brain injury, also known as TBI. Traumatic brain injury occurs when an external mechanical force causes brain dysfunction. Traumatic brain injury usually results from a violent blow or jolt to the head or body. Symptoms of TBI also include lack of focus, difficulty with reading, short or long-term memory problems, walking issues, slurred speech, or breathing issues. The last section is developmental delay. Developmental delay is when your child does not reach their developmental milestones at the expected time. If the child is temporarily lagging behind, that is not called developmental delay. Delay can occur in one of many areas, for example, gross or fine motor language skills or thinking skills. The symptoms include not following objects when they're young, distance from people, and cannot stand while being supported or cannot use sentences properly.